Let's talk belly button necrosis. So, this is actually relatively common in both the tummy tuck population, but also with deep flap patients. So, when we're doing a tummy tuck or a deep flap, we're making a little incision around the belly button and dissecting down to the abdominal wall. And there's little blood vessels around the belly button that help provide its food. And when we're doing this, we could be eliminating their food source, and that's not good. So, with a deep flap, we're often very close to the belly button because those little blood vessels are also what keeps your deep flap alive. And so, you tend to have issues with that surgery as well. Now, if you're having a hernia repair at the time of a tummy tuck, especially if it's a larger hernia, you increase the risk that you have trouble with the skin dying. So what does this look like? It's very different than fat necrosis. So fat necrosis is under the skin, you can't see it, but skin necrosis you can see. So right after surgery, if there's a problem with the blood supply, this tissue is typically a bit purple, a little darker in color than the surrounding skin. And then you'll see an evolution over the next couple of weeks where the tissue will become darker and darker and eventually turn into what we call an eschar, and it will turn black. Now, usually these little eschars, we just leave them alone because they eventually will just fall off on their own and be healed underneath. So your surgeon will probably have you do some kind of dressing changes. I typically just have my patients paint it with betadine to keep it nice and dry, but also it's an antimicrobial, but every surgeon has different preferences. So this can be really alarming, obviously, as a patient. Nobody wants to see this on their body, but believe it or not, once that little eschar falls off, it usually looks really good. We always joke that sometimes it looks better than a belly button after a tummy tuck normally looks. It just looks great. It typically scars down into a very belly button like shape and looks great. And you also usually don't have the little circle incisions, so that's kind of nice too. So although we hate complications like this is a complication that typically for most patients end up with an aesthetic result that's not too bad and not too different than what it would have been in the first place. So I'm sorry you're going through this. I hope your surgeon is being attentive and helping you because I know it can be very alarming, but hopefully everything heals really nicely. And a year from now, the whole experience is just a distant memory and you have a gorgeous tummy tuck.